Joining us today is Professor Barbara Horner, Clinical Director, Curtin Health Innovation Research Institute, Director, Centre for Research on Ageing at Curtin University of Technology, who'll be speaking at IIR's Clinical Training and Workforce Planning Summit 2010, taking place on the 31st of August to 1st of September in Melbourne. Hello, Barbara. Thanks for joining us.
Hi, thank you.
First of all, can you briefly give me an overview of Curtin's IPEC programme?
Yes, certainly. Curtin University, through the Faculty of Health Sciences, has made some strategic decisions around how they want to deliver their undergraduate and postgraduate education program, based on a number, I guess, of key principles. Firstly, that we recognise we need to change the way we're educating our health professionals for the future, that the health environment is ever changing and we need to be able to respond quickly to that, that there are key strategies that are needed to educate health professionals so that they can learn more about each other's profession and to share knowledge and skills and attitudes so that there's a better chance that they will be able to collaborate in practice. And so we've moved down the path of a much more interprofessional focus to our education. And this, we hope, will produce some integrated and interprofessional results in terms of the education, so that we're much more able to respond to the needs of the health workforce in the future.
And how can you integrate research, education and practice to ensure the provision of culturally appropriate primary health care?
Well, we've taken the decision that the three of them work very closely together. Our work is based on the principle that research provides evidence to shape teaching and learning approaches, both from education delivery as well as assessment and clinical practice. We also believe that teaching and learning informs practice and asks the questions that should be driving our research agenda in this area. And we also believe that practice provides an environment for the application of that learning and that research. So we see them as all very closely integrated.
How can the currently overstretched clinical training capacity be expanded?
Yes, that's a big challenge for all of us, and I think it's led universities to identify that they need to be much more innovative in the way they provide clinical practice. We know that we have an environment and partners that have a number of demands placed upon them by many different institutions. So our approach is to look for new partners and innovative approaches, so partners who perhaps may not have provided much clinical experience in the past. Also different environments, both on campus, utilising clinical practice that can be obtained within clinics on campus, and also a commitment to simulated learning environments. We've been looking for a way to personalise the outcomes for the partner as well as for the university, so look at how we can reward a partner for their commitment to our teaching and learning, what's important to them, and how we can both attract them to a partnership with the university but also reward them in a way that they see value for their investment.
How can external partnerships with significant service providers be built, and for what mutual benefit?
Well, I think all partnerships are based on relationships, and that they come from fundamental commitment to both respect and trust each other. I don't think partnerships just happen. I think you need to have a very strong relationship in the first place. And with that and the respect and the trust that comes with that, you can then look at ways of working more closely together. You need to first perform at a partnership level to be able to recognise each other's values and recognise what's important to each other. I think you need to look for benefits for all, so you need to be looking for opportunities to build workforce and providing partners with a chance to recruit for their own workforce for the future. One of the outcomes of having students is to be able to measure their achievements and have, I guess, the first look at graduates of the future. And I think we ought to be working with partners to achieve that or to facilitate that where possible. And I think it's to provide rewards that are meaningful to a partner. So moving beyond perhaps just the associate level or a relationship that maybe includes access to the library, but rather include opportunities to participate in research, opportunities to develop a publication profile, and look for benefits that are particularly useful to that partner. But those benefits need to be quite specific for each partnership. So I don't think taking a one-size-fits-all approach is particularly useful.
How would an integrated health and wellness centre benefit healthcare in the community?
I think one of the strongest complaints we hear from the community is that they feel at times they are shunted from health provider to health provider. And I think an integrated health and wellness centre provides an authentic, practice-based learning environment where students can develop knowledge and skills that are going to be required for the future, but it has a patient-centred and collaborative practice approach. So the concept of a one-stop shop, or the concept of coming to one clinic within a health and wellness centre, that then means you can be alerted to what's available or what's possible for you, that it's a wellness approach. It looks beyond just one particular incident of illness or one particular reason for coming to a clinic. I think it also, so in that way, I think it benefits the community. I think it also provides a team approach for workforce development, so that practitioners working in that kind of an environment have a much better understanding of each other's strengths, can work together as a team, can develop common skills and common understandings. They can still develop discipline-specific competencies, but they can also get a much better understanding of how they can work together to realise outcomes for the client. And I think you can get levels of effectiveness and efficiency that perhaps you don't get or that is difficult to achieve when you're working in siloed practices.
You're speaking at IIR's Clinical Training and Workforce Planning Summit, which takes place on the 31st of August to the 1st of September 2010 in Melbourne. What will be the focus of your presentation?
I'd like to give participants an understanding of the foundations that underpin our approach, where that approach has come from, what the principles are on which we've based it, and how we have changed the business of the faculty to realise those new goals and objectives. I'd like to talk about the achievements to date in terms of interprofessional education, in terms of clinical practice, and also that relationship between research and practice, and to then outline our future directions in terms of partnerships and new clinical placement opportunities.
Barbara Horner, many thanks for your time.
Thank you.